In this video, we'll talk about intraductal papilloma. As you can see in the picture, this is the duct. Inside the duct, there is a tumor which is known as intraductal tumor. So what happens if the tumor is growing in size, it will rupture the surrounding lactiferous duct, which will cause bloody nipple discharge, right? So the patient presents with bloody nipple discharge in this intraductal papilloma. As it is lined by the epithelium, it is also known as true polyp. This whole duct is lined by the epithelium. Within the epithelium, there is a tumor growth. So it is known as true polyp. So now if you look at the text, intraductal papilloma is the most common cause of bloody discharge from the nipple. Intraductal papilloma is also known as true polyp because it is lined by the epithelium, right? So what is happening in this condition? There is blockage of lactiferous duct, which will cause ductal dilatation, and then the rupture of the lactiferous duct will cause bloody discharge from the nipple. So it is arising from the single lactiferous duct. Usually it is single, or it can also arise from multiple lactiferous ducts. Usually it is less than 1 centimeter in size, and the small lump beneath the areola can be seen. Rarely any cystic soft swelling might be present, which might obstruct this duct and cause bleeding. So what is happening here? See, this is the breast and this is the lactiferous duct, right? So sometimes what happens, there might be cystic swelling present in the breast, which might compress this lactiferous duct and which will present as this bloody discharge from the nipple. And sometimes a small lump may also grow in size, and sometimes it may also project out like a pedunculated mass. Vascular stalk may also be seen. Coming to the presentation, it can present unilaterally or it can present bilaterally, but most commonly unilateral, and it can occur single or multiple. So if there is multiple intraductal papillomas, it can be pre-malignant condition, and also it can occur subareolar region or also peripherally, but most commonly in the subareolar region. Clinical features: there may be small lump in the subareolar region, a papilliferous swelling seen near the nipple orifice, and also it secretes serous or the serosanguinous discharge, bloody discharge from the nipple, right? Investigations: you will do this FNAC from the discharge, you will study this under FNAC, and then you can do ductogram, where you will inject this contrast into the duct to see if there is any blockage in the duct. And also mammography can be seen, where you can see this dense lesions under the areola. And treatment is micrododectomy, where this lactiferous duct which is probed is opened, and then you will excise this papilloma. This is known as tennis racket appearance, right? So the differential diagnosis is you can rule out other invasive papillary carcinomas or any papillomatosis conditions. So in the micrododectomy, what will we do? We'll do the complete excision of the duct along with the tumor. So in the picture you can see this is the intraductal tumor which is growing in size and rupturing this lactiferous duct, which will cause bleeding from nipple, bloody discharge from the nipple, right? So intraductal papilloma ruptures the lactiferous duct, most common cause of bloody discharge from the nipple. Usually it is a benign, but if any multiple intraductal papillomas are present, it can be pre-malignant condition, right? So this is about it. Bye.